Oh. That. Okay, let's see. Booyah. So let me see if I can get this set up right. Because I have not done this in a minute. Sit up here and wait for people to come in. Hello, everyone. What's up? Oh, Jesus. Hello. Wait on a few more people to come into the room and we'll get started. Oh, me. Hello, hello. Hello, Perry. Hey, Roniza. Am I saying that correctly, Roniza? How's everyone doing? Wait for a few more people to get in here and then I'll start. Because like there's literally only one person here right now. And it's Sunday. Happy Halloween, everyone. Happy Halloween. Perry. Yes, I'm going to talk about that, Perry. Just give me a second. Yeah, but short answer, yes, I am. Currently. So I'm gonna get to that in just a moment. Let me wait for people to come on in. Sit with me. Happy Halloween. What's y'all plans for Halloween? Ronisha, got you. Ronisha, got you. Thank you for correcting me. Those of you guys who are in the room, go ahead and give this a thumbs up to bring more people in so we can have a variety of different questions and concerns for people. Just because I know that nursing is so wide scope. Like all nursing students, whether you guys are in nursing LPN programs, RN programs, BSN programs, MSN programs, all those. So go ahead and like the video now so we can get more people in here. And my mouth is dry, y'all. So hold on, give me a minute. Hold on. Don't be looking at my room because my room is a mess. Yes. Come on in the room. Come on in the room. Jesus. Perry. Perry, so I live in Las Vegas. I'm going to the strip tonight. Oh, I know that is going to be so fun. I am so jealous. I was just in Vegas for my boyfriend's birthday, September. We had so much fun. Hello, everyone. Hello, Caleb. Welcome. Just getting my mouth ready because I'm about to talk and run my mouth. Hey, Brooks Baldwin. When you transitioning from LPN to RN, what was your study method? Oh God, that's a loaded question. Brooks, so what I did, so to me, like if I knew what the teacher was going to be discussing prior to the lecture, I went ahead and read the chapter and highlighted the things I was unclear about. That way, I'm not completely like a deer in headlights with him and her talk or discussing it. I went ahead so I can kind of follow along and then just had jot down any questions I had. But the thing about studying for nursing school, Brooks Baldwin, is that you have got to study a little bit every day. Like if let's say you're having a test on the endocrine system, right? And the test is going to be in 2 weeks. You need to start studying like now, because if you take that whole like the whole endocrine system and start just studying like diabetes and um thyroid disease, like it's gonna overwhelm you. So start studying little bits now. That way it's not so crazy when it comes time for you. And that way you won't be having to crunch. Because crunching never does well. You really need to understand the material in nursing school. It's not like you can't nursing tests is not like just regurgitation of information. You have to learn to apply it. That would be some of my advice. Brooks Baldwin. Perry, I've been here 6 months. I love it. I'm getting ready to take NCLEX. I'm ready and confident. Yes, Perry. Kill that NCLEX. Kill it. I did a video, Perry, too, on NCLEX on how to prepare for NCLEX. So go ahead, watch it if you have not. I gave some great tips. So congrats. Brooks Baldwin, I hope I answered your question. So what is everybody doing for Halloween? Are you guys doing anything special for Halloween? Oh God. Those of you guys who can tell, I'm in a hotel room because I am on a travel assignment. You're welcome, Perry. I'm on a travel assignment, everybody. I took a crisis assignment in Oregon, so I'm in Portland, Oregon. It's only a 6-week assignment, and I have been here for about 3 weeks. So I only got like 3 weeks left. So I go home. So I'll be home right before Thanksgiving. And the money's good. So I wanted to go ahead and run out really quick, take like a 4 or 6 week assignment and run back before Thanksgiving. Come back home before Thanksgiving. So hey guys, those of you guys who are just entering, go ahead and give this video a thumbs up to bring more people into the room so the conversation can be more diverse. Let me see. Caleb, secure the bag. I'm trying to. Oh, yo. I'm trying to secure the bag. That's why I'm out here in Portland, Oregon. Like, let me show y'all the view from my window, though. It's slick cute. It's slick cute. I'm not gonna lie. It's slick cute. Like, I'm backed up to trees. If you guys can see. So, yeah. Here we are. Back again. Let me see. Somebody just said something. Is it possible to work while in nursing school without my grades taking a hit? Him. So, kind of go back and get a little bit versed in me. I worked through every single nursing program I have ever went through full time. As in LPN school, I was a full-time CNA. In RN school, I was a full-time LPN. BSN school and my master's program worked full-time. Now, with that being said, I did not have many other elements that distracted me. For example, I was not married. I did not have children. So I devoted all of my time to studying. So I know they tell you when you first get into these programs that you can't work, it's impossible to work. But that's a lie. I work. It's just all about how bad you want it. It's all about how much work you're willing to put into it. I go into things with the mindset that I can do it. It's just how much am I going to put into it? So it can be done. It can be absolutely be done here. You can work a full-time job and pass nursing school. And in nursing school, it's not about grades. I mean, it's about grades, but it's not about A's and B's. C equals nurse, and I'm sure you've heard that. So it's like you don't have to be an A student because you're not gonna make no more than the girl that made A's all through nursing school. So that makes no difference. So absolutely, you can absolutely work through nursing school. Hey, you guys, those of you guys who just came into the room, give this video a thumbs up so we can get more people in here so we can really discuss some diverse things. I want to touch on a little bit of travel nursing. I want to touch on pay. I want to touch on nursing school and preparing for the NCLEX. So I really want this video to be very well rounded. So give me these questions, talk to me, tell me what's going on. Um, you're welcome, him. I will. You're very welcome. It is my pleasure. It is my pleasure. But don't be discouraged. Don't be discouraged. I promise you, this is going to work out for your good. So go ahead and give this video a like. Let's get the chat going. I'm here to answer all questions. What are you guys doing? What programs are you guys in? Are you guys in nursing programs? And tell me what programs you're in. Talk to me. Do I have any travel nurses in the group today? Talk to me. It's a Sunday and I know it's Halloween, so y'all probably are out here living y'all best lives. I'm in a hotel room, unfortunately, and I'm not working today. But then again, at the same time, what else could I be doing? I don't have any children to take trick-or-treating, so that's that on that. Yeah, talk to me, guys. And then also, too, like, hold on, I just got a program. I'm in an accelerated master's entry of nursing program, getting ready for my first quarter. I'm an accelerated master's entry of nursing program, getting ready to enter my final quarter in school. Okay. Roshina, I don't know what is an accelerated master's entry of nursing program. I don't know what that is. Like, what degree are you trying to go get? Caleb, in a associate degree nursing first semester. Ooh, you have. All right, Caleb. So I got you. You fresh. You're fresh. So yes. Hey, K Michelle, you caught a live, and I know I did not tell anybody that I was going live, but this was a spirit of the moment thing because I got canceled this morning, so I was like, I don't know what I'm doing. You haven't missed much, K Michelle. I just said that I was just talking about I am on a travel assignment right now in Oregon. So yeah, that. That's why I'm in a hotel room. Y'all know I'm not at home because I'm in this hotel room. And I think my last one or two videos have been from this room. So it's like, what am I doing? Where am I? Brooks Baldwin, that's what I'm doing, working full-time in LPN school. Do you read entire chapters or mostly just PowerPoint? Saunders NCLEX book practice questions. I need 3 classes to become an RN. So I'm working full-time in LPN school. I'm a little confused, Brooks. So you're in LPN school now? You said I just need 3 classes to become an RN. So, like, what are you doing? So are you in LPN school, or are you in RN school, or some type of a transition program? Roshina, those who have bachelor's degrees in non-nursing field want to get their master's in nursing without having to go back to get another bachelor's degree. Oh, okay, I got you, Roshina. I know exactly what you're talking about. Okay, got you. Those accelerated programs, I got you. I just needed some clarification. Good for you. Go ahead and get that. Go ahead and get that. And it's so good that I think that they are doing those accelerated programs, so you don't have to go and like accumulate all of this all this debt if you already have degrees. So good for you. Perry, are you working in a hospital? I am working in some type of a crisis stabilization unit. They have, it's basically almost like it's a unit to where like they place people in group homes, and they come to this unit when they still are like need medical treatment, and then they send them out to a group home. So it's like a staging area almost. Okay, Michelle, the boring states got the money. I know. I have not been to a good state yet with these travel shit. You guys know I was in Iowa, whack. I was in El Paso, trash, And now I am in fucking Oregon. The fuck? Baldwin, I'm an LPN now, doing the LPN to RN bridge program. Got you, Brooks. Thank you for clarifying. So what I did, Brooks, if it depends on your instructor too, because sometimes reading the PowerPoints are not enough. You got to really go in and read the chapter too. Because if you have those whack professors like I used to have, that would only put the outline of stuff on their PowerPoints and you had to go in and fill in more information. If you can do that, then that's great. But there's a lot of knowledge in the book too, you guys. But don't get too much into the book to where it's like the teachers won't be testing on that material, because you can go and get into the book and read too much into it and the teacher may not even be testing you on it. So the book PowerPoints are good to show you where the teachers deem is the most important information, and then maybe go to the book for clarification. So it can kind of get a little foggy there. Okay, Michelle, I have one semester left. I'm transitioning to RN. I failed my last test, shaking my head, barely passing, but C's get degrees. That's what I just said. Okay, Michelle, I said C's get degrees. I said C equals nurse, because you ain't gonna make no more money as an A nurse versus a C nurse, okay? So yes, absolutely. I'm sorry that you failed that test, K Michelle, but that shit happens. Move forward, pick yourself up, dust yourself off, and hit it again. ABGs is the next test. Any advice on how you studied, Adam? Oh, girl, K Michelle. ABGs is something I have never understood. I understand like the acidity of the blood and shit. I don't know if y'all are doing that little diagram that they gave you, like the little where you put this here and this here. K Michelle, I have no advice on the ABGs. I'm sorry. To this day, I don't know. I just let the respiratory therapists deal with that shit. They know about that. Perry, those select all that apply questions drive me crazy. Absolutely. Absolutely, they do. My thing about the select all that apply, Perry, is that once you read the question, read the answers. Check everything that you know for a fact is true. Check it off. If you have to think too long about it, it's wrong. So try that. Do it. Like if you have, Perry, if you have like an app on your phone, and you can go through the questions really quickly, kind of see how you do with reading the questions, selecting the ones that you absolutely know are right, and then the ones that may be a little foggy, leave them off and see how you do. That's how I got through the select all that apply, because they throw those ones in there to trick you. Like if you, like you say, the question is this: A, B, I know for a fact are true. C, I know for a fact are wrong. And then you got that one that's like, it's wrong. Keep moving. Keep moving. Thank you, Brooks. I appreciate it. I try. Okay, Michelle, my instructor sucks. I skim the chapter and read all the boxes. I also do questions each night. Do you think I should be doing more? Read all the boxes. I also do questions each night. Do you think I should be doing more? What do you mean you read the boxes? What boxes are you reading? And also too, it may be also too, Michelle, like it may are you having issues applying the information you learn? Because like I was saying earlier, one thing about nursing is that it's not just regurgitation of facts. You can know that the potassium needs to be this, but can you apply that information? So what I sometimes would do, K Michelle, if you have some nursing friends that you are cool with, y'all in the same program, get together and we would study together. And it would be so crazy because we would throw out like scenarios like at each other, like, hey, Michelle, you walk into a room, a patient's oxygen is this, and they got this going on. What you gonna do? And then we would throw out, well, what if this happens? So we had a lot of fun applying it to each other. Yeah, keeps Michelle. K Michelle, I have a little ABG diagram from Simple Nursing. The guy's pretty good. The select all apply keeps getting me to on test. I got to keep doing my questions each night. Yes, I've come too far to give up now. Don't give up at all, K Michelle. But you're right. The select all the apply questions are made to trip you up. And like I said, when you read this has worked for me. You know, everybody's different, but one thing that has worked for me with the select all to apply is read the question, read the answers. If you know for a fact without the shadow of a doubt that something is right, check. If you know one is wrong, don't check. That one that is, if you got one that you back and forth on, don't select it because it's wrong. They throw it in there to intentionally throw you off. Game shit, all the colored boxes in the books, they always say never skipped anything colored, right? This is true. This is true. So I think you're doing enough, Michelle. I think sometimes what trips up a lot of people is the application of the stuff being considered. Um, and you know, and then like there is also too, okay, Michelle, and for everybody else that's watching, Kaplan has a priority worksheet or something. Like if you completely see a question and you don't have no idea what the fuck it's talking about, you don't know what this disease process is. There's like a priority box on Kaplan's website. I don't know. If I find it, I'll probably try to get it to you guys. But it's like, of course, airway, breathing, circulation, safety. Never say why. Never ask why. Things like that. So if you completely trumped, and then you have to go to the answers, and answers that you know are automatically wrong, keep on going. I think I'm reading too much into questions too. I'll assume information that ain't even in the question. Never assume, K Michelle. Never assume. And also another tip too. I'll go in there and act like you are in. And also too, sometimes what trips us up, okay, Michelle, because I think you're an LPN, so you're going from LPN to RN. One thing that trips us LPNs up is, especially dealing with RN stuff, is that we are practicing nurses. So we have this background knowledge of how things are really going on and where we work, and we try to apply that, but we have to remember that we are in NCLEX Hospital. We are in NCLEX University. Everything is perfect. We have as much supplies as we need. We have as much staff as we need. Everything is perfect. So I think we go back into practice and start thinking about our practice when we really need to be thinking about this is a perfect situation. Okay, Michelle, are you an ICU nurse? No, I am a med surg nurse. Yes, Michelle. Like I'm telling you, Michelle, that NCLEX, that real world is gonna mess you up. You are in NCLEX world. Everything is perfect. You got 27 nurses. You got 100 CNAs. Like you are good. You good. You have to get out of the practice because I used to do that too. Like this is not really that's going on. I am in NCLEX world. So yeah, that's one thing that's going from LPN to RN that really messes us up because we thinking that we are just like we going back to practice. So I got you. So good luck on that next test, Kate Michelle. I hope some of this information has helped. Those of you guys are in the room, give me a thumbs up so people can see this video and come and tune in with us. What questions do you guys have? You guys, I am answering all types of nursing questions. Um, I am talking about travel nursing, pay, my bachelor's program, my master's program, my LPN program, my RN program. Um, let's see. I wanted to be straight ER, but I went to the cath lab for observation, and now I low-key love it. Cath lab, yeah, I would do cath lab. I think you need some ICU experience, K Michelle, to get in cath lab, I think. But yeah, I would love like cath lab or interventional radiology. But a lot of those want you to have ICU experience, and I don't have the ICU experience right now. So I would definitely like that. Taylor's past and present. Hey, Adam, I'm in RN to BSN program now. It's way harder than I thought. I'm trying to get into the mode of writing papers again. I have big dreams. I'll keep you posted. Good luck, Taylor. And yes, the RN to BSN is all a bunch of papers. I know it's not you. And unfortunately, Taylor, you're not gonna get away from the papers. In the master's program, it's even worse. So one thing I would say, if you're having issues with papers, Taylor, depending on what program you're with, went with Western Governors University. They had a great writing center. There are a lot of resources online regarding like APA. Um, And reach out if your university has resources. Taylor, reach out to those people. That's what you paying for. Reach out to these people. But I understand the BSN is a lot of writing. It's a lot of writing, and it's a lot of bullshitting too. So you got to learn how to kind of bullshit. Brooks Baldwin, when you transition from nursing to the hospital, what was your experience? When you transition from the nursing, are you meaning nursing home, Brooks? The reason I won't get on the road, the reason I won't get on the road now is the LPNs only get like 25 a week as opposed to RNs getting 10 grand a week. I just can't do it our way. So, K Michelle, 25 a week for LPN is pretty good. That's like $10,000 a month if you think about it. But what me and my bestie was just talking about this, we can't compare, you can't compare to what everybody else is getting if you don't meet that criteria. And when I mean that, because I'm out here as an RN, I'm not even making 10 grand a week. So the 10 grand a week is like working 60 hours, 72 hours a week. And they like ICU nurses. So RNs getting 10 grand a week. It's a few of RNs getting 10 grand a week, but it's not like I'm not out here getting no 10 grand a week. I'm just not. But you in school, K Michelle, so you can't do that right now anyway. K Michelle, I'm stopping at BSC and I'm tired of school. I understand. I understand. Kayla, what type of jobs would you recommend for a nursing student? Seems like hospitals only want techs who work nights. Caleb, see if the hospital that you want to work at, see if they have a sitters program. Let me tell y'all, if I could have been a sitter at a hospital while I was in nursing school, man, my life would have been cake. Depending on how much they pay the sitters. Now, I still need to make ends meet. But, Caleb, that's a way that you could work and particularly do one at nighttime because, like I said, like being a sitter at a hospital, people at different hospitals call them different things. Some people call them safety attendants, stuff like that. It's a motherfucker that sits in the room and makes sure the patients don't hurt themselves. If I had a job like that allowed me to work and like do my studying at work, man, it would be love. So check and see what they have. Taylor's past, thank you. I need to reach out to the writing center. Yes, Taylor, reach out to the writing center and do it while you're writing the paper, you know. And then also too, Taylor, if you're with the writing center, get an email address of one of the people that work at the writing center. That way you can like shoot them quick emails while you're writing. Because if it's anything like Western Governors University, sometimes you would have to book an appointment. But I had one girl that I could just email really quickly and she would email me back if I had questions about like APA or grammar or something like that. Brooks, hey, so let's go back to your question, Brooks. When you transitioned from the nursing home to the hospital, how was your experience? I had a good experience, Brooks, actually. Going from the hospital from the nursing home to the hospital, I didn't realize how overworked I was at the nursing home. And the transition was good, but I had a good foundation of nursing, meaning I knew how to prioritize, I knew how to work, I knew how to manage 25 to 30 patients. So it was a good transition. It was really a good transition. Hey Belinda Akeley, thank you from California. Thank you, Caleb. Thank you. I saw one of those positions. Yes, Caleb, get on that. I don't know how much they make. I don't think they make a whole lot, but if you just need to work, yeah, I mean that's the plug right there. I'm telling you. Roshina, how much experience did you need when you got your first travel nursing job? So most travel companies want you to have at least a year of experience in whatever specialty you're traveling on. Like if it's med surge, 1 year of med surge experience. If it's ICU, 1 year of ICU experience. Of course, I've been a nurse over 10 years and I had been in the hospital for 3 years. Personally speaking, and this is just me coming from my own personal opinion, I don't think you need to travel with less than 2 years of experience. Because when I tell you, when you take these travel jobs, when you are being thrown into whatever and everything, and you are supposed to swim, you really need to have a good foundation. I would not say tell a nursing student who just got out of school, like, hey, you got 1 year of experience and 1 year of nursing experience all together, and you go travel? No, I say 2 years. I say 2 years. That's just me, because you just getting ready to be thrown out there, and I struggle too sometimes. And I've been a nurse for 10 years. So boom. Hey Michelle, I heard about crucial working them like dogs. You're right. So those are the nurses that are making the $10,000, but they working 72 hours a week. Uh-uh. Mm-mm. I can't. I can't. I won't. Okay, Michelle, can you share what company you're with? I love to keep companies in my back pocket. Michelle, direct message me on Instagram, because I can't talk too much about it here. And I'll tell you. I'll give you more details. Especially because I'm going to upload this video as a real video. Because usually I take my lives down. Because I talk about stuff that I don't want to be repeated over and over again. But okay, Michelle, direct message me on Instagram and I'll give you the tea. At Adam Deshawn. Thank you. All the way up to 12 people. Groundbreaking. Hey, you guys who just came into the room, give this video a thumbs up so we can get it out to the world. So we can really get some more people in here, so we can really, you guys, I'm answering questions regarding travel nursing, nursing programs, NCLEX, anything regarding nursing. Please talk to me. Tell me what you guys' concerns are. What questions do you have? I really do wish I had a nurse. When I was coming up in nursing, I really wish I had a nurse to go to that could really give me the rundown of everything. Nursing has become so catty and rank heavy. It is so difficult to find nurses that are like educationally higher than you, give you very true and authentic information. It is so hard because it's so catty. Everybody's trying to run over each other to do more, and it's crazy. Yane Porter, I live in Tennessee, but I'm currently in Oregon right now. Okay, Michelle, I think I'll do 2 years. I see now as LPN, they want to throw you out there when I travel locally. Child, I ain't met the DONs or the administrators of none of these buildings I've been in. And you probably won't. Okay, Michelle, you probably won't. And like you said, like, it's one thing too, like, and that's one thing, one reason I say be very well trained in your field, because um, when I tell you that they throw you out there, they throw you out there. Like, no, 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 there's nothing to play about. And if you're gonna be working in a hospital, that gets even more dangerous, because you're dealing with sick and unstable patients, and you can't just be throwing people out there. So that's why I say nurses need to be very seasoned before they start traveling. That's my opinion, because I see on these travel nurse groups that they say, "Hey, I just got out of nursing school. How soon can I travel?" And my reaction is always, "You really trying to lose this license quick, ain't you?" Because I'm telling you, as a travel nurse, you are expected to be very trained and seasoned to understand what's going on. And if something happens, like if something fucks up, you going under the bus. They throwing you under the bus quick, like for real. Taylor's past and present. How many weeks off in between assignments do you take? Taylor, this weeks. Taylor, I took 3 months off. This is my first time working in 3 months. Those of you guys who follow me know I've left El Paso in July, and I've been off for 3 months. Like, so I've been weeks, no months. Okay. Tanya Clark. Hey, Tanya. Hey, Adam. A YouTube name. Hey, Darnell was talking about new nurses doing travel nursing. He said the same thing you said, at least 2 years experience. He just posted it about 3 or 4 days ago. And I agree with them. I agree with them, Toya. Just because it's one thing to know your unit, but it's another thing and how your unit do things. And you can be feeling good on your unit, but you know your unit. But when you go out into a whole nother hospital and you only get 3 days of orientation, if that, and you are expected to get out here and function just like the rest of these staff nurses who got 3 months of training, it's different. It's different. Hey, Yane Porter, I'm just finishing the LVN program. I need to know what to study for the NCLEX. Kaplan. Yane, if you have, I don't know, like, I don't know if you can do like get the Kaplan NCLEX study book. There's programs. The Kaplan offers like an NCLEX prep course. I think it's like $400. It was included into my program, but I absolutely recommend Kaplan all day long. And they ain't giving me no money. Kaplan is not giving me no money, and I'm recommending them for real. Okay, Michelle, I'm getting burnt out too. Moral is low because nursing isn't what people think it is. Facts. Okay, Michelle, facts. Caleb, Adam, I went to Motlow in Smyrna in Tennessee. What I would do, Caleb, whenever you get out of school, look for programs, look for hospitals that offer nurse residency programs. I know there are, since you in the Tennessee metro area, I know a lot of the HCA hospitals offer residency programs, and residency programs kind of help new nurses really transition to functioning as a well-versed staff nurse. So look for those type of hospitals. What's this? C treatment, CTX, orientation ain't nothing, especially if you're not familiar with the e-charting system. Meditech is a hot mess. You're exactly right. Because the charting system alone may be something that you need to completely get used to. I came from working with Meditech. Meditech is a hot mess, but I got used to it. I came from working from Meditech. My last hospital assignment was Cerner, so I had to learn a whole new system. So yeah, you are expected to get out there and perform like a nurse. So you really need experience before you travel. And I know this money look good, but think about if you get out here, travel, lose your license, then you ain't got no money. So look at it like that. Yes, I thought you were gonna sit down into 2022. Michelle, I said that, didn't I? Okay, Michelle, I said I was gonna sit down to 2022, didn't I? I said that. I said that, but I knew that was a lie when I said it. I did. I can't sit down for that long. Especially this money start coming up too. I was like, whoop, let me run out here real quick. I did say that. Hey, Simone, I cannot pronounce your last name. Giselle Simone, I look well. Thank you. I feel well. Thank you. Thank you. I appreciate that. Okay, Michelle, you gotta know how to get in that bag and then sit down for a minute. Self-care is the move. These companies do not care about you. You'll work into a grave if you let, yes, they will. Okay, Michelle, they will. And that's why I sat my ass down for, I think, Taylor, past and present, you said self-care earlier. Absolutely. That was self-care. I sat down for straight 3 months and didn't do nothing, but focused on myself, exercise, ate right. I don't know if you guys can tell I lost some weight. So I've just been like living my life, trying to get my hair together. Y'all, I've been on a hair journey, so that too. Past and present local travel assignments are good to start after 2 years experience. In my state, 40 miles is considered travel nursing. That's a good option, Taylor. Absolutely. And that's what I'm going to do when I get home. I think I'm going to look into local stuff because my boyfriend is not loving this travel shit. When I told him I was leaving, he kind of looked at me like, again. I was like, but when I get home, I'm definitely going to look into something local. Definitely going to look into something local. Kayla, what fears did you have about getting into travel nursing? I had a lot of fears, like getting into a new unit, getting a very limited amount of training, going to a new state where I had no idea what was going on, where I was going. And I've been going to very extreme places. Like, it'd be different if I was going to places like Georgia, because I'm in Tennessee. So Georgia, Alabama, Kentucky. I've been to those states and I kind of know how they function. But I went to Iowa, El Paso, Texas. I'm in Oregon. So it's like, there's a lot of fears. There's a lot of fears. Those are just some of them. Giselle, what unit is your dream unit? I used to think I wanted to do ICU. I don't think so anymore. I really want I really want to try hospice, and this is not a unit. This is just an area of nursing. I want to do hospice. I really want to try hospice because like I did nursing home. I've done hospital. I kind of want to try hospice and see what that's about. Okay, Michelle, once I'm done, I'm going to do my 3 days in the hospital and supplement on some days off with local travel because I'm really going to be taking pay cut to go to a hospital. I'm in Florida. Yeah, ooh, Florida. Ooh, girl. Florida is very low pay for nurses. Kayla, we are still waiting on that hair video. I think I'm gonna do one. I think I'm gonna do one pretty soon because I'm trying to like nursing is good and all, but I think I'm going to try to expand what I discuss on my channel. So I got you, Caleb. Just give me some time. I got to get home first. I can't do a hair video here. Yane Porter, how many months should I study before I take the NCLEX? I wouldn't say there was no amount of time that you should study. Um, Yane, I would not take a long time to study for the NCLEX after you graduate, just because the longer you wait, the more information you lose. What I did when I graduated from my nursing programs, LPN and RN, after I got my authority to test in the email, I booked it out 2 weeks. So I say the quicker the better. I mean, the quicker the better. I mean, you can't relearn everything. You just have to brush up on stuff. So I say I waited 2 weeks. So, but that's just me. Let's see. TX, I'm a newbie in ICU. I was drawn to hospice, low-key interested in med surg too. I miss talking to patients. Talking to patients is overrated. Talking to patients is overrated. I'm just saying, it is. Giselle, say it again. I live in Florida and they are trying to offer me scraps. Yes. Yeah, Florida pay is I think I was reading some kind of an article about the lowest paying states, and Florida was like up there. Like paying Florida is trash. It's trash. So I feel sorry for y'all in Florida. You stroll and make sure I'm not missing anything. Giselle, 25.50. That's insulting. That's insulting. And then also too, you guys, what we have to do is also we have to band together as nurses and not take these low rates. Everybody is, I think if we all band together as nurses to really band together and say what we are not going to take, they don't have any choice but to raise it up. Because what else they gonna do? You gotta have nurses. I'm sorry, y'all. Woo. Yane Porter, will you come to California? California, y'all state taxes don't even be worth me coming to California. Like state taxes and the cost of living in California, it's like I might as well stay home. So no. Unless they are offering, like unless they're paying to stay, unless like the company is paying me or is paying for the hotel and everything or the house, I ain't fooling with California. Wow, just I had to work. Yeah, that's trash. Yeah. So see, I think is it CTX or C treatments, because that's the abbreviation for treatments. But yeah, I heard 22 in Miami, and they demand BSNs. Child, ain't even a nurses to go around, and y'all trying to cry about having somebody having a BSN. You better be glad that you got what you got. Wow. I agree, K Michelle. That's like whenever I do start working local again, whenever this travel money just becomes not worth me traveling anymore, because I'm be honest with you, I don't really too much care for travel nursing, the money, the opportunities here, but I like being at home too much. But yeah, I'm not taking scraps. I'm just not. Brooks Baldwin, it's crazy because I make 29 base pay and 4 more on the weekends. I live in Savannah, Georgia, but work in South Carolina. That's my only fear is a pay drop in the hospital as an RN. See Texas, get thank you. Okay, so Brooks Baldwin, yeah. So I don't know you guys though, because when I went from nursing home to hospital, it was a pay raise for me. But that just might have been because I was getting paid utter trash at the nursing home. Um, that's me. Sorry, my best friend is my best friend. Let me text my best friend something really quick, y'all, because she's on live too. Let me see. See text. It will not be worse than Florida. Well, this has been some years ago. This was like 2018 when I transitioned from nursing home to hospital. And I know for me it was an increase, but then again, that just might have been because I was getting paid trash. My thing is, K Michelle, my thing is when I come to these buildings, I'm probably gonna have 30 to 40 patients because all the other nurses done quit. If you think I'm gonna accept low pay and low staff, you crazy. You exactly right. You're exactly right, K Michelle. Especially if you're doing agency and stuff. Because of course agency unfortunately get probably the worst assignments. Um so yeah, I'm with you. I'm with you, K Michelle. Because they do want you, these nursing homes, y'all, they work you like dogs. I'm telling you. And these poor patients, the poor patients, is ridiculous. I can't do travel nursing until 1 year. Oh, let me read that again, Giselle. I can't do travel nursing until 1 year. That cross the board. I think they feed off new nurses that are just happy to get a job. And that may be it too. Because a new nurse is not going to really combat what you say that she can make, he or she can make. So it's like they'll take whatever. Right. So that's like K Michelle, yeah, Florida is low pay, Giselle, but I'm a hard worker. So when I go to into buildings through agency, I get in good with the staffing coordinators and negotiate a better rate for me to show up. That part, K Michelle. That's what you do. That's what you do. That's what I plan to start doing more when I get home is getting to because the agency I'm with a couple agencies at home. Really haven't worked with any of them, but whenever I do get back to work with them, I'm going to probably get in with the staffing coordinator, especially if I like the facility. If the facility's okay, I'll go there more than once. It's about getting to a facility, especially with agency nursing, about getting with the facility, getting into a facility that that you kind of like, and then just kind of ask for more money. Giselle, I should probably do home health. I don't have any experience with home health, but maybe somebody else in here has done home health and they can give you more advice, Giselle, on home health. I just haven't done any. I haven't done any home health before, and I would be scared that people's houses are nasty. That is a huge fear of mine. It's like taking home a roach or something in my work bag. I would be outdone. I would be outdone. Like for real, I would be outdone. So that's my fear with working into, because I know people are nasty. So that's my fear working in home health. Taking home a roach or a bed bug. Mm-mm. Absolutely not. Just said I was out for my dream job, oncology. So why haven't you taken it? Oncology. Yeah, I can't. I did. So in El Paso, I worked on an oncology floor. Um, and I didn't too much care for it. Giselle, because of low pay. Well, then Giselle, so it's like you can't have it. You sometimes you can't have it all, Giselle. I mean, is it going to be something you love? Because usually something that you really enjoy or something that's a little bit easier may not be what the best paying one, but it just depends on what you hold value to. Like if it's something I really enjoy, I wouldn't care about the pay, but I understand that pay is a absolute element. Tanya Clark, home health is okay. After a while, you get tired of driving in those nasty ass houses. That's my problem. Toya, that's my problem. Nasty houses. I'm real funny about stuff like that. Okay, Michelle, what I noticed about in hospice in Florida seems like they trying to kill the people. I've seen people die too early. It just discourages me from even to attempt hospice. I understand. I don't know if it's trying to kill people, okay, Michelle. Let me hush. I don't know because I've never worked it, so I can't even give an opinion on that. I just know I've had a lot of interaction with hospice nurses, being that I come from long term care. So I know that um, that is a lot of. I've worked closely with them. I've never been a hospice nurse, so let me shut up because I can't give you an opinion on that. Kay Michelle, I'm looking to also start a YouTube channel. Any advice, Adam? I don't have an iPhone, so what equipment do you use? Should I use? Kay Michelle, I record all my videos on my phone. It's an iPhone though. But I don't have any special equipment. I do have a ring light, which I don't have with me. But the only thing I can say is just start talking. I mean, I'm only at like 300 something subscribers, and I've been doing this 10 years, but I haven't I put a whole lot of time in it. I'm just starting to now really try to invest time into my YouTube channel, just because I have achieved so much and I understand that people want to know about it. So I would just say, I don't even think you have to have an iPhone. Get a phone, start uploading videos, and see how people respond to it. Just do it, Cambridge. What, it can't hurt nothing. Just there. I only take one. I'm not going to. Hey Michelle, I am not going into nobody house that's nasty. I'm going to get fired on that day. I have heard stories. Yeah, I've heard stories too. See, Texas, that's the number one misconception of hospital nurses, as told by a hospice nurse too. Actually, so that's something that I hear a lot too about hospice nurses, is that they go in and try to kill the patients. Now, I know that not to be the truth, only because I had worked very closely with hospice nurses and I understand the logic of hospice. And it's not trying to kill the patient, it's about making their transition as comfortable as possible. And that makes a lot of people uncomfortable. And also, it makes some nurses uncomfortable too. See, Texas, I have personally withdrawn on several and managed a hospice patient in the unit until they pass. So you have an understanding. And I have an understanding. Working in long-term care, we have a lot of, because hospice is an outside entity. So they come into the nursing home to see about patients. So I understand it to a certain extent. See, Texas. The disease cues them, you manage their pain and clinical symptoms of death, like death rattles with atropine, so families can stay sane. Right, exactly. Giselle, what resources did you use for NCLEX? Kaplan. Kaplan. Absolutely. Kaplan is probably, and I use Kaplan from my RN, not from my LPN. I don't really remember what I did for my LPN because that's been like years ago. But for my RN, I used Kaplan, and I really did think that um it was the best resource. The best resource. Did you use the CAT exams. I have no, I didn't use that. I don't know what that is. Hey Michelle, I really want to grow my channel. It is income. They'll keep paying. Also, it makes you your own boss. Are you monetized? Am I asking too much business? No, I mean I'm monetized. I am monetized, K Michelle. It's not a lot of income though, honestly. It's not a lot of income. I think you really start getting a lot of income when you start get so big to where you start getting endorsed and you get paid to promote products and stuff, which is where I'm trying to get to. But like being monetized just means that people can put ads on your videos, and that don't drink that does not bring a lot of money unless you have a lot of views. And I'm kind of my views are kind of which is why I'm trying to put more into it to kind of bring my video my views up and stuff like that. All this stuff is free information on YouTube, K Michelle. Just look into it. Just look into it. Computer adaptive exams is like a mock NCLEX exam. They sell them for $100 for three. Hmm. I mean, I guess. Giselle, I guess. That's up to you. If you feel like I didn't use all that, but I would never tell anybody what not to do that would help them pass the NCLEX because we're all different. I didn't use any of those things. I just studied my core content, understood disease processes, understood labs, and really did questions, so that I could get into the habit of understanding the questions, answering the questions, and reading the rationale. So I didn't have a lot of gimmicks to pass NCLEX. Okay, Michelle, did you get all the Mark? Hold on, did you get all the Mark Klemic stuff from? I see broken up lectures on YouTube. I don't know what that is, K Michelle. Somebody else mentioned, yeah, the Mark. Yeah, I don't know who is he the dude that runs like the is he like the dude I can't describe him, like the white guy, dark hair, mustache, beard? Is that him? Is the guy who wrote is Klemic is the guy who wrote NCLEX. I don't know who this man is. Like Kiki Palmer. I hate to say it. I hope I don't sound ridiculous. I don't know who this man is. Sorry to this man. I don't know. Um, exactly. I want to endorse products I believe in. That's where I'll see the money exactly. So it's hard to get there, K Michelle. I've been trying to get there for years. Um, but it's like what you put into it. I have not been putting a lot into mine because I've been doing this for years, 10 years. You guys have followed me for 10 years, all the way back when I was in LPN school. And I just have very, very sporadically done videos. So I'm gonna put more into it now that I have more time on my hands. Um, is the dude who helped writes the NCLEX. Okay, I don't know who this man is, y'all. I have to look him up. But I thought the NCLEX was organized by like the National Council of somebody. Let me Google this man. If this is the dude I'm thinking about, because I got my laptop in front of me too, y'all. Let me look this man up. Klemic. Let me see. Okay, yeah, I've never heard of this man, but y'all, I'm not gonna say don't use him. But do your thing. If he helps, do it. Absolutely. Okay, Toya. He's good on breaking down NCLEX questions and tells you what to focus on. Do it. Do it. I don't think he was out when I took the NCLEX. I don't think he was out because I took my last NCLEX. I took it in 2016. So I don't know who this man is, but if he is helpful, by all means, yes, do what he says. Do what he says. Do absolutely. Just say, how do not get overwhelmed by with NCLEX material. Giselle, you need to get you a calendar, a big calendar. Put it on your wall. Each day, you need to map out what you're going to study for that day. If you need to talk about, if you're gonna study diabetes, hypertension, if you want to study lab values this day, if you want to study medications this day, if you want to study heart medications this day, it has to be broken down. Get a big calendar, put it on your wall, and do it that way. Yes, period. NCLEX, like Kaplan to me, like um mimic the NCLEX almost to a T. Like it was almost like whoever wrote for Kaplan wrote for NCLEX too, because I could have sworn like some of those questions I was taking while studying for Kaplan were the same questions I saw in the NCLEX. That's why I recommend Kaplan so much. Giselle, Kaplan questions are hard. They are hard. That's why I thought too. I was just like, man, these are hard questions, but they prepared me for the NCLEX. They really did. It really did. Right. It costs money, Giselle. It costs money. So one thing I would say, K Michelle, I would so this is okay. So I saw you ask Tanya about using something that will help you pass NCLEX and pass school. These are two different entities. I'm sorry, but they are. Um, I would not advise you to use NCLEX material to help you through school. Only because school stuff is very specific to instructors and what instructors feel important, right? NCLEX is going to be more broad. So and I say that, and I wouldn't tell you this if I have not fallen from this same way of thinking, because I was one that really studied my NCLEX book, and I remember there were several questions that I was studying my NCLEX book and studying the teachers information and was getting them mixed up and messed up on the test because I was thinking about the NCLEX and she was teaching something. And not saying that these two this information is not similar, but you can really get tripped up with what the NCLEX is saying versus um what a teacher is testing on. These can be two different things. So just be careful with that, because I know it messed me up. It really messed me up. So pay it like whatever the teacher, because the teachers are the one writing these questions. So it's a difference. So just be careful with that. What else y'all got before I get up off of here? I think I'm gonna go to the gym downstairs today, and I may order some food. The food here has been trash. I'm sorry. Like I have ordered food from all around here, and it's all been trash. And y'all know how you order food, and like I'm having to. So I'm out here on an assignment, and I don't have a car because they take me back and forth to work. Um, But I've been having to do a lot of Uber Eats and a lot of DoorDash, and ain't nothing like spending like $30 on food with like delivery fees and all these service fees and get the food and it's trash. You welcome, K Michelle. Love to heal. I'm currently in LVN in California trying to get the courage to go to RN school. Um Love to heal. I understand. It's first of all, you need to realize that you are worthy to go to RN school. You can do it. It's just how much work are you willing to put into it? Um, and also too, what do you want to do as an RN? You know, that should propel you forward to going to RN school. You've been in LVN for 15 years, and I know you are probably stuck in your ways. But RN is definitely going to get you out of your comfort zone. And I was an LPN for I think 5 years before I became an RN, and it was difficult for me to come out of that. So I say go after. If you really want to do it, love to heal, you need to go after. And there is no time like the present. Tomorrow is not promised to nobody. I say go after it now. And ask yourself, what is holding you back? Giselle, I just graduated with 4 kids. See, Giselle did it with 4 kids. Lord have mercy. I did it with no kids, but I had a full-time job. So that's my little thing. You're welcome. So you guys, I'm about to get off here and go down to the gym and get me something to eat. This has been a very insightful live. I thank you all for tuning in. Thank you guys for the questions. I really appreciate it. Um, I hope I answered all of your questions. The next time I go live, I'm going to try to give notice before I go live just so I can have a bigger audience. But it's like, for me to go live, it's such a spontaneous thing because I have to be like bored or not doing anything. It's hard for me to schedule a live. It really is. But you guys, if you guys have not already done so, go ahead and give this video a thumbs up and like. If you have not subscribed to my channel, please do so. And you guys also stay tuned. I think I'm gonna start an Instagram, not an Instagram page. I already got an Instagram page. I think I'm gonna start a Facebook page as well. So just stay tuned for that. Thank you guys for tuning in. Bye-bye. How do I get out of here? Okay.